you are negative, you'll be permitted to leave the isolation facility. If you are positive, you will remain in the isolation facility until you turn negative. These positive cases amongst inbound travelers are going to be subject to further analysis in the Lagos State Biobank to see if these passengers are carrying the mutations or the new strains that are circulating around the world. This is important for us to know because, first of all, it tells us what's happening within the Lagos community, but also the treatments may become slightly different depending on what the scientific community is picking up around the world. Lagos State has just enacted a law. It's called the Lagos State Coronavirus Pandemic Law. It was enacted this year, and it gives Mr. Governor, the incident commander, the right to determine who is to be quarantined and for how long, and there are very stiff penalties for people who are going to be disobeying these laws. These laws are currently in operation, and the sanctions for breaking the law can range between imprisonment or hefty fines. And we are going to take this very seriously because it is important that Lagos State protects itself from any possibility of allowing a third wave to emanate within the boundaries of this state. So normally, we always emphasize the non-pharmaceutical interventions, hand hygiene, respiratory hygiene, restrictions on gatherings that may become super spreader events, and ensuring that if you feel unwell, that you go and get tested, and if you are tested and you're positive, that you maintain the guidelines, which are to self-isolate at home. Let's move our attention to the vaccination strategy, and I'm going to give you data. First of all, global data on the effectiveness of vaccinations. And in this graph, you can see in the United States that vaccination has been demonstrated to be effective. Over here, you can see that the number of persons aged 85 who have contracted the virus is very low compared to the younger population who did not receive the first dose of the vaccine and were susceptible to contracting the virus. So the green space here demonstrates the effectiveness of the virus in preventing people who have had the vaccination from contracting the virus in such a way that makes them unwell enough to be hospitalized. So with this evidence, we are more encouraged about our vaccine strategy. It has been demonstrated in several places around the world that the vaccination does give some degree of protection from hospitalization after contracting the virus. Indeed, you all know that many people, or much of the literature suggests that the vaccination does not protect you completely or 100%, but what we're confident about now is that while it may not protect you from contracting the virus, it certainly protects you from becoming very unwell, severely ill, critically ill, and suffer a fatal illness as a result of COVID-19. So in Lagos, the data there shows that in Lagos we vaccinated over 200,000 individuals on their first dose. We're just about to round up the administration of the first dose of AstraZeneca, and in another 2 weeks we're going to be commencing administration of the second dose to those who have received the first dose. And that will complete, at the end of that exercise, it will complete our first attempt at COVID-19 vaccination in the state. We've learned a lot of lessons. We've learned lessons around logistics. We've learned lessons around adverse events. And we've learned lessons on how to manage crowds and how to deliver these vaccines effectively. We've also learned a lot about the adverse events and how to manage them and how to protect people from the adverse events or complications of the adverse events. So the main local government areas that have received vaccination are mainland, Poshofe and Surulere, and they have been the most recipients of the virus, of the vaccine. And as we move along now, we're going to be administering the second dose. So in addition to the 507,000 doses that we got from the federal government, we've also received in the last few days an additional consignment of 57,000 doses extra of AstraZeneca. These doses, we have decided to continue to vaccinate for that. That's equivalent to vaccination of 28,000 people, because if we are administering 2 doses per person, if you divide 57 by 2, you will get just over 28,000. So these extra doses are giving us the opportunity to vaccinate an additional 28,000 people for the first dose, and then follow those up with the second dose. Now, in view of the fact that we are receiving people in Lagos as travelers who are turning positive on day 7 test, we have decided to use some of these extra vaccines that we've received from the federal government in a strategy that we describe as the ring vaccination strategy. It is a well-known strategy for preventing the transmission of a virus into community. And what this diagram shows is that a number of people who are coming into Lagos are turning positive on day 7. Those individuals by nationality are Nigerians returning from countries into Lagos, India, and China. So those are the top groups of travelers who on arrival are testing positive on day 7 during their home isolation. So these people that turn positive, what we're trying to do now is to use some of these extra vaccines in what we describe as a ring vaccination strategy. So in the center there, you can see an individual that has turned positive. And of course, that individual is isolating at home, typically. Now, that makes the members of that household, no matter how careful you are, it makes you vulnerable to contracting the virus. So the ring vaccination strategy, when we get somebody that has turned positive, who has recently returned from abroad, and you have tested positive, then we will be deploying some of the vaccines to vaccinate members of their family, their immediate household, to stop the transmission of the virus from the traveler to family members or people that live in the same home or in the same immediate jurisdiction. So we're hoping that this opportunity to use these extra vaccines that we're getting from Abuja in an intelligent way to really add to our attempt to stop this virus from coming into Lagos, but if it does come into Lagos through a traveler, we stop it from being transmitted to their household members and then from the household members into the community. This is a very effective strategy. It has been deployed in Ebola. It has been deployed in the past with smallpox. And we believe if we're able to deploy it here, it may add to our strategy to reduce the opportunity for Lagosians to experience a third wave. Now, while I told you that we have come out of the second wave, so we are in what we call the valley after the second wave, Lagos is not resting. We are doing a number of things, and if you can see from this diagram, the gray graph represents our first wave, and the orange graph represents our second wave. In between our first wave and second wave, we were not resting. We were building capacity, continuous surveillance. We were training our health personnel. We were improving our health infrastructure. We were defining policies and governance to ensure that we are able to manage this COVID more effectively. We continued with our public education around the issues of risk, and we've been building research capabilities and developing capacity in the Lagos State Biobank to characterize the virus. Now that we've passed the second wave, this same list applies. We are not resting. We are preparing and building resilience, first of all, to ensure that we make it very difficult for a mutant or new strain virus to enter Lagos. But if it should, that we stop it in its tracks and we stop it from being transmitted into community and causing community transmission. This is the Lagos State Biobank. In this biobank, we are defining significant amount of capacity. We are training, we're adding more staff. We are increasing our biotechnological capacity to characterize the virus. And here I'll show you a cartoon. On the left is what it looks like within the biobank. Very sophisticated equipment where our personnel are working under biosecurity conditions to test for the virus, but also to test the characteristics of the virus. On the right is a cartoon of how this virus is changing. So the original virus has mutated into several different strains characterized by this cartoon, and it is important that we in Lagos are able to understand which one of these new strains, either the Indian, the Brazilian, the South African, or the European virus, is circulating in the country, and to understand the dynamics of these viruses and what type of pathology these different viruses cause within citizens of Lagos State. To do this, we are doing several things within the Lagos State Biobank. We are increasing our spectrum of PCR kits. We are, as I explained to you earlier on, we are not only doing the ordinary PCR test, we are doing the PCR mutation analysis. So if your test is positive with the normal PCR, we then conduct a second test to try and define which one of the mutants a positive traveler is carrying, or indeed a positive person within the community of Lagos. We are also developing the capacity to sequence with partners, and also Mr. Governor has approved that Lagos State moves quickly ahead to develop sequencing ability within the Ministry of Health to ensure that we can characterize the virus through very advanced molecular biology technology. Our isolation facilities are still there. We are maintaining them. We're using them now for the mandatory isolation of passengers that are traveling from India, Brazil, or Turkey. In addition, we are keeping them on high alert should in case we start to pick up cases within the community. We're also building up our capacity to treat severe to critical cases in ICUs with specialist training and ensuring that our equipment is up and running and in a state of readiness to manage cases that may be presenting with respiratory or systems failure. On a lighter note, we're keeping our isolation facilities friendly, happy with paintings and drawings, so that in case you happen to be isolated, that you are maintained in a high state of mental stimulation, and you're feeling good when you have to be put in one of these isolation facilities. In addition, we have built 10 sample collection and oxygen centers across different locations in Lagos. We're going to be using these facilities for anybody who is developing symptoms of COVID to come to these facilities and get tested. In addition, the facilities are divided into two. There's the area where you get tested, and there's an area where you can receive emergency oxygen. One of the lessons we learned in the first and second wave is that when patients need oxygen, they need oxygen very quickly, and sometimes it takes you a long time to get from your home to one of our isolation facilities where we can administer oxygen. So these 10 facilities will act as a halfway house where you can go there for emergency oxygen, we can stabilize you, and then we can move you with an ambulance to one of our isolation centers with oxygen. We noticed in the first and second wave that some people were dying on their way to our isolation facilities or soon on arrival, because it is important that when you are in a desperate need of oxygen, that you get oxygen very quickly. You're well aware that Lagos State has been building oxygen plants. We have built 2 oxygen plants, one in IDH, the Infectious Disease Hospital at Yaba. It has been commissioned more than a month ago. It is producing 60 large cylinders of oxygen a day. In addition, we've just commissioned another one at Bagada General Hospital. It is also has the same capacity, and it is also live and producing oxygen. We will soon have a third one at Lasuth, and we're looking at a 4th one, just to make sure that in Lagos, should we have a situation where we experience a 3rd wave and where people are in dire need of oxygen, that we are not stretched beyond our limits to deliver oxygen to save lives, which we all know that oxygen is a very critical part of the management of COVID-19 respiratory failure. These oxygen plants have been a collaboration between the Bill and Melinda Gates Foundation and Total and the Lagos State Government and the Ministry of Health. On that note, I will end my presentation, and I'm happy to take questions.
Thank you very much, Honorable Commissioner, for Professor Akin Apoyoni. Gentlemen of the press, the floor is now open. I want to point it out to us that we should try and make it more medical, our question, because that is the essence of this press briefing. Who is going to bail us out with the first question?
Good afternoon, Prof.
Afternoon.
The name is Tokumo Ituji from Arise TV. I'd like to find out from you. You told us what the protocols will be like at the airport. I'd like to know what the protocols will equally look like at other entry points different from the airport. That's number one. You gave us a figure of about 200,000 people vaccinated already in Lagos. I will need you to be exact, because a few days ago when you briefed us during the interministerial briefing, you said 260,000 precautions. Do we still stand by that figure, or there's a slight difference? I would like a clarification on this new consignment of vaccine that Lagos has taken. You said it's from the FG, and it's going to be deployed for the new strategy of monitoring people who are coming in and their family members who may likely be affected. Is it deployed strictly for that, or as a Lagosian who is eligible to take the vaccine can go to any center and get vaccinated? Those are my questions for now. Thank you.
Any other question, please?
My name is Amina Telebshi, health correspondent, Lagos Television. I'm asking this question on behalf of some women that has requested, because we know the vaccine cannot be administered to pregnant women. So now, for a woman who has gotten the first dose in the last 10 weeks and in the process got pregnant, can the person get the second dose? Thank you.
Eventually get infected with this virus, how are they going to be treated?
Since we're talking about prevention strategy,
Gloria Oshunwagan, it's a report for the ITA. Since you're looking at preventive strategies, I would like you to give us detail of that law, the pandemic law by Lagos State government. So I'm letting more people hear it to help them to comply. Thank you.
And the last question for this set.
Thank you very much. My name is Theophilus Ilamaka of TBC News. I want to ask now, there have been a lot of people who are afraid of taking the vaccine. What plans are there for the Lagos State government to ensure that vaccine apathy is reduced?
Honorable Commissioner, sir, you have the floor, sir.
So thank you, Tokumbo, for that question around the protocol. So the immediate need is the airport, where thousands of people come in on a daily basis, and it's most likely that we will see mutants and new strains coming in through the airport. That is the most important means of entering Lagos. We are fully aware of the land border and the seaports. So the land border on the border with Benin Republic, and of course the arrival of ships or cargo vessels by sea. So it's the same Port Health Authority that manages the airport, the land border, and the sea. So we're working very closely with the National Port Health Authority. We're putting the same protocols in place at all three border entries. But the emphasis is on the airport at the moment, because that's the most likely route that a passenger will be bringing in a mutant or a strain. Now, it's possible that to try and beat the protocol, people will go to neighboring countries and come in by road, or by sea. So we are wary of that. We are aware, and we're putting things in place to make sure that we understand where your port of destination, where you boarded your flight, your departure, and that we can track your travel history and apply the same sanctions to you, whether you're coming in through the airport, through the land border, or through sea. Your question around the vaccination, we are vaccinating every day, so the number keeps changing. It was 266,000 as of yesterday, and by the time we finish vaccinating today and tomorrow, it will go up slightly as we're preparing for consuming the new consignment and also preparing to administer the second dose to those who've received the first dose. So the additional consignment we've received from Abuja is part of the same stock. It's to be used in the same manner that we've been deploying all along. So we have our vaccination centers, and people can walk into those vaccination centers and receive their vaccines. In addition, as I said, we will be using some of that consignment to protect family members of persons who have turned positive after returning from abroad. This will be, we hope, an effective way of creating a shield around an individual who has contracted the virus outside of Nigeria, and therefore it is possible or quite likely that that virus is one of the mutants or one of the new strains. So we don't want that virus, we don't want to give that virus the opportunity to be transmitted into communities. So by protecting the immediate family members of passengers who've arrived in Nigeria and who turned positive and are likely to be carrying a mutation, using that strategy, we can reduce the risk of community transmission. And community transmission, we're very, very careful that we don't want community transmission of new strains and new mutants. Aminat, you asked about administration of vaccines to pregnant women. So it is still not approved for pregnancy. So if you've received the first dose prior to becoming pregnant, then you will not be given the second dose until you deliver your child. And as soon as you've delivered your child, you may receive the second dose. That is the current international guidelines. It may change if we start to conduct trials on children particularly and on pregnant women. Those guidelines may change, but as it stands at the moment, we are not vaccinating pregnant women or children under the age of 18. That's the current international guidelines which we've adopted. Although things are changing, but we're monitoring those changes. Titi, from Channels, you asked about the long-term plans for vaccination. Yes, of course. You know, the vaccines were never trialed in Africa. And so this first consignment that we received courtesy of the federal government, it was important for us, before we rush out as a nation or even as a state to acquire vaccines, you know, it's important that we understand how our people are responding to the vaccine. So the administration of over 500,000 doses of a particular brand of the vaccine is a very important learning experience for us, just to see how Lagosians are responding to the vaccine, to see what kind of adverse events we're experiencing, to see whether this vaccine is indeed protecting us from subsequent virus exposure and contracting the virus. So we're doing a lot of observation, we're gathering a lot of data, and we're doing a lot of research amongst the people who have received this vaccine, including myself and other members of cabinet. So everybody who's received the vaccine now is being observed one way or the other, and we're looking out for adverse events, and we're also going to be tracking whether those who have received the vaccine are still able to contract the virus, and if they do, what is the clinical outcome of you contracting the virus after you've been vaccinated. So at the end, we're only halfway through. We've administered the first dose of the over 500,000 doses we've received. We still have to administer the second dose to those who have received the first dose. So we've learned a lot from the administration of the first dose. Now, administering the second dose may not be exactly the same as the first dose, because now your body has been primed with the first dose. We give you the second dose. We're not sure how you will respond to the second dose. So generally, the international literature suggests that some people may have a slightly stronger adverse event reaction around after the second dose, but not much different from the first dose. So we want to see in Lagos what happens to people who get the second dose and what the profile of their symptoms might be after the second dose. By and large, the adverse events around the first dose have been very mild with, as I described, a bit of body pain, some fever, pain at the injection site, a bit of Panadol, and a good night's rest usually takes care of that. Now, when we move into the second administration of the second dose, we will be observing how Lagosians are responding to the second dose. As I showed you on one of the graphs, it is now clear, there's clear evidence that vaccination protects communities from severe COVID-19 illness and hospitalization. The end result of what we're trying to do is to stop people from dying. You can get COVID, but we hope that your COVID infection will be asymptomatic, mild, or moderate. We don't want patients going into the severe to the critical, where we have to admit you and give you high levels of oxygen or put you in an ICU. At the end of the day, we just want to stop people from dying. And if we can do that using a vaccine strategy or a treatment strategy, more importantly, a prevention strategy, then that's what Lagos is trying to do. Gloria, you wanted details of the new COVID-19 pandemic law. Essentially, it gives Mr. Governor, the incident commander, the power to define who should be isolated, when, and for how long, and what rules should be put in place to protect Lagosians from a devastating pandemic. So the law is quite specific. It's quite a long series of clauses. And for example, if we say that you need to be under mandatory isolation on arrival from any of those 3 countries, and we find that you are breaking the law, we just have to report you to the law enforcement agencies, and they will prosecute you according to this new law. And the sanctions are, and they range from imprisonment to heavy fines. And we are about to enforce these laws, because if you break the law, you are putting Lagosians and citizens of this state at risk. If you have traveled into this country, the law at the moment states that you must undergo a 7-day mandatory isolation. If you are traveling in from one of the 3 countries nominated by the federal government, Brazil, India, and Turkey, then you will, in addition, you will be isolated at a designated facility. We will give you the options and you will choose. In those facilities, you will be supervised. The reason for this is because we want to make sure that nobody is coming into contact with you during those 7 days. In addition, you'll be tested immediately on arrival at the facility, and you'll be tested again on day 7. So if you break these laws, then it is our prerogative to ensure that law enforcement agents are aware of you contravening the law, and that you could be and will be prosecuted if it is proven that you've gone against the laws that we have just pronounced. Theophilus, you asked about the fear of vaccines in Lagos. Well, to be honest, we've found a large amount of desire to be vaccinated in Lagos. So there is some vaccine hesitancy in Lagos, but we feel that there is more overwhelming demand for the vaccine. So we're not too worried about vaccine apathy in Lagos. When we do get more consignments, we believe that many Lagosians are willing to be vaccinated. We are encouraging it because of what we're seeing in India and in Brazil. Even though those countries have a certain amount of their population have been vaccinated, they've still gone through devastating 3rd waves. We don't want that to happen in Lagos, so we are moving as fast as we can with prevention strategies, with mitigation strategies, and obviously we're very keen to roll out the vaccine strategy once we've learned exactly how Lagosians respond to the 1st and 2nd dose of the COVID-19 vaccine. Thank you very much.
Thank you very much, Governor Commissioner. Is there another question, please?
Dr. Mustafa, do you want to say anything? Okay.
My name is Ben Salam. I like Preparedness. You said some of those will be coming actually from the countries of Japan and the amber countries like Lagos and I will be staying in state isolation centers. Is there a cost that they will be bearing for doing that, and the subsequent tests will be doing as a result of staying in isolation centers? Then for the countries that the FG mentioned, they said those who are citizens of the state, that's those countries, but should not come in. But yes, those who are Nigerians can come in. Is that same scenario with the ambassadors countries? Thank you.
I understand from an interview of Mr. Governor that I watched recently that Lagos state government is actually making some arrangements for vaccines. Do you have any updates on that side that you may want to give us? Then about the few clotting cases that were recorded during the last vaccination, you said you were doing some prepared to some further analysis. What do you have to tell us about that? Thank you.
My name is Rita. I represent the newspaper. Honorable Commissioner, any moment from now, some Nigerians will be returning from Saudi Arabia after
Okay, thank you very much. Benga, you asked about the protocol for isolation for anyone coming in from the 3 countries that the federal government has announced. So these 3 countries is where there is an active and severe situation around COVID mutant virus pandemic numbers. So if you're coming in from Brazil, India, or Turkey, you'll be coming in and isolating at your own expense, inclusive of the tests. That means that if you are in India, Brazil, or Turkey at the moment, and you are a Nigerian, or you have immigration status that permits you to live and work in Lagos, then when you come in, if you choose to come in, you must come in prepared to pay for your own isolation and to pay for your testing. We're trying to discourage people from moving around during this pandemic. But if you choose to come home, and as a Nigerian, you have a right to come home. But when you come home, it is mandatory that you isolate for 7 days at a government-accredited isolation facility. And when you go in on the portal to book your return, it gives you options for accommodation. There's a range of accommodation from some of the private isolation facilities to the hotels to some of the private partnerships we have. And you can select which hotel, you pay for it, and you pay for your test. And when you come in, you will be escorted to the facility that you have chosen. This does not apply to the other countries that we are observing. It is only important for us to know which country you're coming from if you arrive in Lagos. If you are not part of the 3 countries that the federal government has announced, but you're coming in from a country where we know there are mutants, then we will just be more diligent about your 7-day isolation. We will be following you up more closely because you'll be at home. A co-telemed will be calling you every day. We will carry out spot checks by visiting you at home. And if we can't find you, then you will be contravening the law. And I've already stipulated that contravening the law now, which is the COVID-19 pandemic law, as released, as signed a few weeks ago, allows the law enforcement agencies to deal with that situation effectively, and you will be prosecuted and the sanctions will be applied. So Tokumba, you asked about the vaccines and this new consignment. Well, the federal government are defining at the moment where Nigerians receive the vaccines from, just to make sure that they are accreditable, they're coming from accreditable manufacturers, that there are no middlemen, and that the accredited distributors of vaccines can bring vaccines into Nigeria. So we're following very closely what the federal government is doing. They're the ones that are advising on where to source the vaccines and to source them and to distribute them to the point of need in Nigeria. So we are working very closely with the Nigerian Primary Healthcare Development Agency, the Federal Ministry of Health, and we're observing the situation. We would very much like to get over this first pilot phase of the over 500,000 doses of vaccines, and then define how to move forward to ramp up our vaccination strategy. Now, those who have not received the vaccines, of course, you are vulnerable, like everyone else. Those who have received the vaccines have hopefully a heightened level of immunological protection. But as time goes on, and the vaccination strategy is going to continue throughout this year and into next year, and who knows where we're going with COVID, we can't define the future just yet, but we certainly know that vaccination is going to be a way of life moving forward. Managing COVID is going to be a way of life. We have to carry on with our economic activities, and that is why Lagos is so aggressive about preventing a 3rd wave, because we don't want to interfere with everybody's day-to-day activity and ability to earn a livelihood. It is important that we keep the economy ticking over, and therefore it is a stitch in time which will save 9. By preventing the importation of mutants is the best way to prevent a third wave. In addition to the use of the standard non-pharmaceutical interventions by preventing super spreader events and everybody being encouraged to maintain personal hygiene. Around the issue of adverse events, yes, we have been investigating about 3 cases of blood clotting associated around the time when the vaccine was administered. Now, people develop blood clots every day. The fact that you've received the vaccine and you develop a blood clot doesn't mean that they're linked. But what we're trying to do is we're investigating all 3 cases, and very shortly we're going to have a concluding report which will help us to understand what indeed is the risk associated with blood clotting after receiving the COVID-19 vaccine. Having said that, the numbers are extremely small. We cannot definitively link the incident of a blood clot to the administration of a vaccine at this point in time, but we're working on trying to effectively understand the relationship between the onset of the blood clots and the time at which the administration of the vaccine took place, and whether there are other circumstances that inside a person's body that could have predisposed them to a blood clot other than the administration of the vaccine. Thank you very much. Oh, Saudi Arabia. Yes, so Saudi Arabia is not on any danger list. We understand that they have a very strict protocol in Saudi Arabia. You need to be tested before you go in. You need to be tested while you're there. And you need to take a test before you start coming back. We know the persons that have gone to Saudi Arabia from Lagos. We have a list from the Pilgrims Board. And as they're coming back into the country, we are going to be enforcing the mandatory 7-day isolation at home. So people coming back from Saudi Arabia will just follow the standard protocol and guidelines. When you get back from the pilgrimage, you go straight to your house, you isolate for 7 days. On day 7, you do your PCR test, and if you're negative, you're free to come out of isolation. If you're positive, then we will then apply the standard guidelines for managing positive cases in the state, especially now around people who turn positive after returning from international travel, as I outlined in the presentation. Thank you very much.
Thank you very much, Honourable Commissioner, for Professor Akin Abayemi. I want to quickly recognize the presence of the Permanent Secretary, Primary Healthcare Board, Dr. Ibrahim Mustafa. You're welcome. Honourable Commissioner, sir, with your kind permission, I have the honor and privilege to now call on the Honourable Commissioner for Information and Strategy, Mr. Benga Omotosho, for 1 or 2 things to.
Yeah, thank you, ladies and gentlemen. Good afternoon. There is nothing much to say other than to just thank you for keeping this appointment even at such a short notice, and then to tell you that Mr. Governor, Mr. Baide Sanwo-Olu, on whose authority we have addressed you this afternoon, is saying that Lagosians, this is not the time to panic, this is not the time to be anxious, but it is time for us to keep to all the protocols of COVID-19 prevention that have been rolled out by the experts so that we don't have a third wave. It's time for us to be very careful, observe all the non-pharmaceutical protocols that we have been asked to observe, wash our hands as frequently as possible, and then keep social distancing and then try as much as possible to avoid crowds. So once again, I thank you, and I hope that you are going to do justice to this in your reportage. Thank you.
Thank you very much. I believe that we have come to the end of the press briefing on the third wave mitigation being adopted by the Lagos State government. I believe we are on point in Lagos State, and we have the incident commander who is the father of the state and is in full control of the affairs of the state. And now, distinguished ladies and gentlemen, we have come to the end of the press briefing. Thank you. May God, may the good Lord continue to bless you all.